Right, so we'll talk about the Sartorius muscle. This is our Sartorius muscle, which is the longest muscle in the body. It crosses obliquely on the anterior aspect of the thigh from the upper lateral side to the lower medial side. Its origin is from the anterior superior iliac spine, which you remember also happens to be an attachment for your inguinal ligament. It's going to come across all the way down obliquely to have an insertion together with those muscles which you remember calling the pes and serinus muscles. There was going to be one on the anterior thigh, the sartorius, one on the medial, the gracilis, and the semitendinosus on the posterior thigh. Right. Its insertion is onto the upper medial surface of the tibia. Nerve innervation, it belongs to the anterior compartment of the thigh. So it's going to get its innervation from the femoral nerve, in particular L2, L3 roots. Function, it's going to be a flexor of the hip, and it's also going to flex at the knee. Unlike the other muscles on the anterior aspect of the thigh, which when you say they flex the hip, they'll extend the knee, your sartorius will actually flex both the hip end and the knee. On top of that, due to its attachment to the medial aspect of the shaft of the tibia, the upper part that is, it is also going to medially rotate the leg at the knee joint, right? Then also worth remembering that the sartorius muscle will form a boundary for the femoral triangle. This happens to be a femoral triangle, this space here with that muscular flow. So your sartorius will be the lateral boundary of that femoral triangle, right? Then when you go to what we call the Hunter's canal or the subsartorial canal or your adductor canal, you expect the same sartorius muscle to form the antero medial wall, right, of that adductor canal, right? So that's your sartorius muscle.